Well, good afternoon, everyone. As you know, the Senate just voted to proceed to the Obamacare repeal and replacement issue. We'll be on reconciliation for the rest of the week, processing amendments. I've offered one, and then there will be others. It's an open amendment process. This is just the beginning. We're not out here to spike the football. This is a long way, but we'll finish at the end of the week, hopefully, with a measure that can either go to the House and be taken up or go to conference. And so we're pleased to have been able to take the first step in that direction today.
I know we were all glad to see our old friend John McCain, and of course he's full of the same fighting spirit we know him for. But I thought he delivered a very important message and in a very, very timely basis, because this legislation is open for amendment, not just by Republicans, but by Democrats as well. And should our Democratic colleagues, in the spirit of Senator McCain's remarks, decide to participate in the process and build a bipartisan piece of legislation, this could well be the beginning of that healing process for this institution that's become polarized like so much of the American people. So we would invite our Senate colleagues to work with us to make this bill better. This is just the beginning and not the end. So we would invite their participation and help us improve this bill.
Well, obviously we have our work cut out for us. We cleared the first hurdle, but there is obviously a lot of work yet to be done. But I think we all know that what we have today has to be fixed. It's not working. Obamacare is in a death spiral. It's led to higher costs, higher taxes, fewer options for people in this country. Most states, all states, average, have experienced 105% increase in premium since 2013. So as has been pointed out, something has to be done. Status quo is unsustainable. And we want to get to an outcome that brings stability to the markets, that brings more affordability to people in this country who are struggling with the high costs, skyrocketing costs of premiums and deductibles and out-of-pocket costs, that frees them from the mandates, the individual mandate and the employer mandate that is killing jobs in this country, that preserves access to care for people with pre-existing conditions, and that strengthens Medicare for the future. Those are the goals that we laid out. Those remain our goals, and I'm hoping that when we conclude this process at the end of this week, that we will take another step on the way toward liberating people from the high costs and the harm that's been caused by Obamacare, and to give them a better path forward.
It was absolutely wonderful to have John McCain return to the United States Senate with his message of optimism, as he always does as he travels the world representing the United States. And he said the same today on the floor of the Senate. The vote today to proceed, the motion to proceed, is just a first step to an effort to go and address a Senate bill that is necessary. Clearly, the Obama health care law has failed to deliver the things that it had promised. And Democrats from Bill Clinton to Bernie Sanders admit that it has driven prices and costs up for insurance and insurance premiums up. It has taken away choices from so many Americans, and the expenses on the American taxpayer have been astronomical. So as somebody who served in a state legislative body, this is the way in the Wyoming legislature we did all pieces of legislation. You got a bill on the floor, and then you started the amendment process. Members of both parties can offer amendments to try to improve the piece of legislation, and at the end, you come to a decision of do you want to vote for or against the final amended package. That's where we are. My goal is affordable health care for the American people. As a doctor, I just want to make sure people get the care that they need from a doctor that they choose at lower costs.
Nancy?
As you know, the healthcare system is incredibly complicated. Is this a la carte approach to reforming it responsible?
Of course. I mean, it's wide open for amendment. Different people have different ideas about what form it ought to take. We watched a similar process 7 years ago. They had a lot of differences. We're going to sort this out in a thoroughly open